The Adderall shortage is making life tough for patients and families that rely on the medication to treat attention deficit disorder, or ADHD. The huge rise in ADHD diagnosis and in prescribing via telemedicine during the public health emergency seems to be driving the problem, and manufacturers have also had a few supply hiccups. The federal government was getting ready to dial back the availability of controlled substances via telemedicine, but after receiving literally tens of thousands of comments, they decided to keep the pandemic-era rules in place for at least another 6 months. Why is there an Adderall shortage? When will the Adderall shortage end? And is ADHD ever an advantage? Welcome to CareTalk, America's home for incisive debate about healthcare business and policy. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the president of Walgreens Health.
Are you the kind of person who can't get enough CareTalk? Well, I have good news for you. The CareTalk newsletter goes deeper into topics covered on the show. It provides a convenient and reliable way to stay informed on the must-know happenings in healthcare business, policy, and innovation. Click that link in the description to subscribe.
So, David, why are we talking about Adderall at all?
Well, John, a lot of people, most people say, why is there an Adderall shortage as opposed to why are we talking about it at all? And the reason is twofold. There's supply and demand, right? The main reason here seems to be demand. Why is there more demand for Adderall? Mainly because there's been a big increase in the diagnosis of ADHD, especially during the pandemic. It's also now women and girls have the diagnosis. It wasn't not just male as it has been in the past. And in fact, John, there's been a 58% increase in patients aged 22 to 44 from 2018 to 2022 versus a 35% increase for Adderall over time at that same time. So there's a lot of people taking it, a lot of adults with prescriptions.
You with all your statistics, shouldn't we break this down into basics, David? What is Adderall after all? It's a drug that is prescribed by doctors for people with attention deficit and hyperactivity disorder, which is kind of a cluster diagnosis, which has been growing like crazy, that I think increases the amount of dopamine and norepinephrine into the brain, from the brain, to sort of increase the reward functions to help people who the drug could help focus a bit more at a period of time when our entire culture is suffering from attention overload and lots of sort of the digitalization of our everyday life. And I think that that Adderall is one of a family of stimulants, really, that are used that appear to be prescribed pretty liberally by doctors to people like you who have a hard time focusing on one thing at a time.
John, it's prescribed to people like everybody, not just to me. There's the demand side. There's a bit on the supply side as well. One of the main manufacturers, which is Teva, had some hiccups along the way before. Some of the manufacturers have blamed actually the DEA, which gets involved because it's a controlled substance, because there's actually a quota of the active ingredient that goes to the manufacturers. But DEA says that's not true. The companies actually aren't using their whole quota.
But how big a problem is this ADHD thing, the attention hyperactivity disorder stuff?
It seems to be a big problem, John. I know that, as a father of kids, many kids in school are taking medication, and sometimes the teachers or the school actually ask people to be tested and to be taking it. So it's pretty common. I know it's a big problem, John, that there's the shortage. What's happening now is you've got some people who can't get it. They can't refill it. Now that causes stress and anxiety. They have to drive further to find it, and they go without their medications. And so, not having it could impact somebody's ability to learn, to work, to socialize, John. So it's
I think that there is attention deficit disorder is a real thing. I know that, I've known kids who have been prescribed it, and it could substantially help them focus in a way that they couldn't otherwise get through a structured day without it. So for those parents, particularly with kids who have a hard time focusing, although it's a lifetime diagnosis potentially, that this drug is a lifesaver or a life complicator if it's not available. So we have gone from a period of oversupply, I guess, during the pandemic, to one of undersupply, because there's complaints up and down the chain. Where do you think the biggest problems are in terms of supplying and meeting the needs of those parents and children who need this drug?
So, John, one of the things is, you gave me a hard time about statistics before, so I won't make statistics, but this is a statistically based observation. They say that actually there's more adults with prescriptions for Adderall than there are people diagnosed with ADHD. So that means that, a lot of people are getting it. So there's a lot of demand for it, including off-label or undiagnosed use. I think it is mostly about just a rising demand, which had to do with the pandemic and also has to do with the idea, hey, it's not just for kids anymore.
Well, I think that there's it is effectively a critical drug for a lot of kids to get through the day, particularly as they're getting through adolescence and all these other things that are driving them, having them bounce off the walls when they're kids. The thing about a drug that can help you focus, whether it's coffee or something that's prescribed, is it's going to be popular, particularly in a culture that's getting oversupplied with stimulants and distracting stimulants. And I know that at Medco at one point it looked to us as if some of the parents were filling their kids' prescriptions and probably borrowing a few pills here and there. It sounds like more and more of that is happening, because the reality is, as a stimulant, it will allow you to kind of stay up longer and potentially focus. And the use of stimulants was probably started by the military in the Second World War and has continued to kind of seep into everyday life, particularly as a productive stimulant to help kids focus. But it is sort of an epidemic. I mean, we're, in addition to having an epidemic of attention distraction, we are seeing an epidemic of prescription in this area. I mean, it is that number of adults taking it versus having a diagnostic identification that they need it is sort of scary.
John, speaking of the military, there was actually an interesting change in military policy I read about in the Wall Street Journal, which is that ADHD diagnosis is no longer disqualifying for someone to be recruited into the military. There was an interesting article, and the main reason for that is probably they're just trying to do recruitment. They don't want to, unnecessarily make the pool too small, especially with all these diagnoses that are out there. There was an interesting letter to the editor from a pediatric neurologist, a scientist, who actually said, well, it's good that the military is letting people in, but also ADHD does have a benefit for certain jobs. And was giving the example of a hunter, somebody that actually could be hypervigilant and notice a small change. And there's obviously applications for that in the military. But John, a lot of jobs, actually, I see a lot of very successful adults, never mind, struggling kids and adolescents, as you'd said. There's jobs that require kind of an awareness of opportunity and danger. A lot of people in venture capital or trading, or people in high tech that actually have ADHD and actually find a way in adulthood to not just conquer it, but actually maybe to use it as a benefit. So we're not clinicians, John, at least I'm not. Maybe you got a degree since we spoke. But, one of the things is that having a restricted supply, maybe some people won't use it and they'll find they don't want to refill it again. Well,
one of the challenges in the restricted supply, which hopefully will sort itself out, is there were these effectively pill mills on the or those who've been criticized as potential pill mills. Some of the online pharmacies were, based on what has been reported, really very there was scant attention paid to whether people actually needed these pills. And if you looked at the proportion of the population versus those who were going to some of the online sources where they would Google how to get it and call up someone, that the online pharmacies, which have now been shut down or at least investigated by the DEA, are substantially restricting what they used to do, which is to kind of pass out those prescriptions pretty easily. I think hopefully that will start to slow down the over-prescribing or the demand side that allow the kids who really need it to get access to it.
Well, John, I'm not sure about that, because I'm not sure about whether it is going to go back to how it was, because before the pandemic, about 2% of stimulant prescriptions were from telemedicine. And as of 2022, it's actually 40%. A big reason for that is the FDA waived this requirement to have an in-person evaluation for controlled substances. Now, there's arguments for doing it. It's convenient. The provider can actually see, theoretically, the patient in their home and, see what they're doing. So there's some use cases for it, but there's probably been a good amount of abuse, at least alleged. And the FDA was planning to actually tighten the controls a bit, and that was supposed to coincide with the end of the public health emergency in mid-May. However, they got so many comments, 38,000 comments, John, that they actually decided to extend the full flexibility for another 6 months or so. And
well, I think to be fair to the people who are criticizing the act, there is the bad actors in this area are alleged to have been spending a lot less time on counseling and evaluation and a lot more time just taking that prescription, taking the request and filling the prescription. And that's not what the point of this is. I mean, these stimulants they do stimulate a lot of things. They can lead to heart problems, dizziness, stomach problems, sleep problems. I mean, if they're improperly prescribed or it's not a good fit, they're not a heads I win, tails I win kind of proposition. They definitely jack up certain processes in the body that in the wrong population can lead to kind of serious illness. And so the challenge to evaluate is still there. But I get the fact that we need to not go completely backwards in terms of convenience, because the healthcare system is anything but. But I do welcome the DEA's and public health authorities really kind of overseeing this to make sure that the right drugs are getting into the right hands. But I mean, David, is it a bad thing that all these adults, I mean, assuming that they could do it without damaging their health, are using performance enhancing drugs? I mean, we allow them to drink coffee. I mean, what's the downside there?
Yeah, I can't comment from a clinical standpoint, John, but I would say that it's good to have more access to things that are going to work. And we have to assume that if there's a diagnosis being made by a physician, that is a right diagnosis for somebody and that treatment is going to be helpful. So in general, I'm in favor of broader access. It's just notable, just how much of an increase there is. And when we've been talking very much about, Adderall, but there's other controlled substances that are also available through telehealth, and the prescriptions for those has gone up, a lot as well. And if you look at it, it's one thing if there's a physician, and they make a diagnosis and then they prescribe something. If it's another thing that if you come with not just your diagnosis, but your prescription that you want, and you call a doctor to get that, there's something wrong with a business, John, that does that. I'll make that observation.
So David, you're a worried parent, and you want to get access to a drug that may or may not be, but could be soon or was recently in short supply. What does a parent do if they're worried about this?
Well, I'll tell you what people have been advised to do on this, which is, first of all, to get the to fill the prescription a little bit early. So I know my own kids, sometimes they'll tell me, "Oh yeah, can I get a refill?" And they're already out that time. Not necessarily for this medication, but for others. There's also other stimulants. You mentioned caffeine, which is certainly not in short supply. But there's other stimulants, and people have been asking their physician about what to do.
Other prescription stimulants.
Other prescription stimulants. That's right. So it's not just Adderall that's available. And then, a broader call your elected representative and tell them to do something about it. I mean, that's what people are doing.
Yeah, I think that this is a case where you want to be aggressive about calling your representative, talking to your doctor, trying to get ahead of it. What I hear about and read about is that in some cases this drug is still in short supply, and I think we've changed with that many adults actually using performance enhancing drugs. I don't think we're going backwards on that. So I think the demand is going to stay up there, but people want to be super careful that for their children that they're getting the right physician's clinical evaluation to make sure that it's doing more good than bad, and that people understand what the downside consequences of it are. I think we don't always necessarily want broader access, but we want easier access for those simpler, more convenient, more access for folks who otherwise have a really hard time getting the drugs they need from their docs and clinicians. I think we're sort of in this interesting period, David, where I think a lot of adults have gotten onto these stimulants and find that they're helpful to them. That's created the demand shortage. And although I think we can solve the demand shortage, I think we're in a new age of prescription performance enhancing drugs that it's just something we ought to be thinking about, particularly under with the risk of the long-term consequences, because each one of these prescription substances is it's a pretty powerful stimulant for the body.
Well, that's it for yet another episode of CareTalk. We've been talking today about ADHD, Adderall, and how it all adds up. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the president of Walgreens Health. If you liked what you heard or you didn't, please subscribe on your favorite service.